Welcome to Aging on the Suncoast. I'm your host, Jason Martino. The National Alliance on Mental Health reports that depression is the leading cause of disability worldwide and is a major contributor to the global burden of disease. The global pandemic greatly made mental health even more challenging. We know that 60% of adults with mental illness did not receive mental health services in the previous year. Last, African Americans and Hispanic Americans were half as likely to utilize mental health services compared to whites. These facts are startling, and we owe it to ourselves to understand mental health much better. So where do we start? Let's start with today's show. I've invited a couple professionals from the Area Agency on Aging serving seniors in Pasco and Pinellas counties. Kristina Jalazo, the Director of Program Accountability, and Didion, our Program Manager, are going to help us understand mental health in older adults. So let's jump right in. Christine, Didion, welcome to our show.
Thank you for having me.
No problem. Christine Jalazo, welcome back to our show. It's been a long time.
Thank you for having me back.
Yeah. So Christine, we're gonna concentrate on mental health. I always like to start off with talking about the issues that are out there, and I guess just real briefly, what is mental health?
That's a good question, because mental health can be pretty convoluted. But in general, mental health is our emotional, social, and psychological well-being. Our mental health can affect how we think, how we feel about things, and how we act. It can impact our relationships with other people, how we handle events in our lives, and on our physical health, how we feel physically.
Yeah, it sounds like it really encompasses everything that we do.
Mm-hmm.
It's a part of us,
Absolutely.
whether we want it or not, and we just have to work through some things. So, numbers-wise, about how many older adults are really affected by mental health issues?
Mental health conditions are very common in the adult population in the United States. The National Alliance on Mental Illness estimates that 1 in 5 adults in the U.S. will experience some kind of mental illness each year. And in fact, they estimate that 1 in 25 adults in the United States will experience a serious mental illness each year. Serious mental illness might be something like schizophrenia, bipolar disorder, or major depression. And like you said earlier, the Centers for Disease Control estimates that mental illness is actually on the rise, and it might be correlated to the COVID-19 pandemic. When they look at surveys that they've conducted recently, there's been a substantial increase in the number of people who self-report at least one kind of behavioral health symptom. And in fact, when they look at surveys that they've done in 2021, the rate of self-reported depression and anxiety has nearly doubled compared to surveys they've done before the pandemic. And if you think about it, that makes a lot of sense. The pandemic has brought about a lot of very unique stressors, like financial hardships, changes in our daily lives, our daily activities, how we do simple things like go grocery shopping, or even how we're able to see family members or friends. And those things by themselves can be a catalyst for the development of a new mental health condition, or it can exacerbate an existing mental health condition as well.
Wow, all good points. You know, the pandemic really was a major disruption in many, many ways.
Absolutely.
And I think that because we indicated that mental health is just the biggest part of how we operate on a normal daily basis, having that disruption is bound to have some issues on it.
Absolutely.
So you touted some great statistics from some great groups, NAMI, and to not use acronyms too much, but the National Alliance on Mental Illness, which we'll talk about a little bit later with Kristina on there. I mean, they do a serious amount of work on that, and obviously the Centers for Disease Control does too. Some of what you talked about is how younger adults are having mental health issues, and then sort of changes as we get older. So how do mental health issues manifest themselves later in life?
Yeah, absolutely. So when we think about mental health, we sometimes might think about younger adults, maybe middle age, even children. We talk a lot about mental health in children, but we don't talk a lot about mental health in older adults. And it's actually very common in older adults, mental health conditions, just like it would be at any other point in your life. The Centers for Disease Control estimates that about 20% of people age 55 and older will experience some kind of mental health condition each year. And depression and anxiety are probably the most common that are experienced in older adults. And often those diagnoses can go hand in hand and can appear at the same time. And like you said, older adults experience a lot of unique life events. retirement or loss of a job or change in career. As we get older, we sometimes unfortunately lose our loved ones, our partners, or other supports that we've leaned on. Also, when we get older, there might be development of a chronic condition, or a chronic condition maybe we've had our whole life becomes or increases in severity. So all those things can contribute to the development of a mental health condition or illness. Another thing that we have to think about with older adults is that mental health conditions often go undiagnosed in those age 55 and older. And that might be because older adults will often focus on the physical aspects of a mental health condition more than they would the psychological or social aspects. So when they are emphasizing maybe muscle pain or changes in their sleep pattern or appetite, a medical professional might misconstrue that as a physical ailment, or might attribute that to a chronic condition that maybe someone is living with instead of a mental health condition.
Well, that's a good point. 20%, that's scary. That's a lot of folks, and,
Sure
and
is.
obviously they that 20% probably changes with different occurrences. Hence the
Absolutely.
pandemic that we've been dealing with for over 2 years now too. You spoke about depression. Depression is not a new term, but just for our viewers, what is depression?
Sure. Depression is characterized by a persistent sadness and, in general, a loss of interest in daily activities or daily life. And it's so much so that it impacts someone's ability to do their normal things that they do throughout the day.
Yeah, and just to get a picture to illustrate how many people are affected by depression, what are we talking about? What are we looking at?
Depression is extremely common. The American Psychiatric Association estimates that about 1 in 15 adults in any given year will experience depression. And they actually estimate that 1 in 6 people will experience depression at any point in their life. So chances are our viewers have experienced depression or know someone who's lived with depression.
Yeah, and I, for one, have also dealt with depression.
Absolutely.
Major occurrences in my life, the significant changes that occur. I'm not afraid to admit that depression has been a part of my
Sure.
life, and fortunately, I've noticed it. A lot of times, people I think that there's just something slightly off, and maybe go undiagnosed, like we had talked about before.
Sure.
And kind of a segue into that, what are the symptoms of depression? How do people know that they may be experiencing depression?
Yeah, like you said, some of the symptoms can kind of creep up on you, and you might think that it's just you feel funky or you don't feel right, when really it could be something that can be really scary and really detrimental not only to your mental health but your physical health as well. Symptoms can vary from person to person, of course, but in general, we might see people self-isolate or not want to leave their homes or not want to engage in activities that they used to. We see with some of our clients that they used to engage in a lot of weekly activities like going to the senior center or going to meet with a group of friends on a regular basis, and suddenly they just stop going. And it's not because of changes to their abilities or changes to their transportation or access to resources to get where they need to go. It's just that they stopped attending. And related to that is that people sometimes, as a symptom, will experience not getting the same joy out of activities that they once enjoyed doing. Again, we see that too with our clients. They've had lifelong hobbies like knitting or model cars, and suddenly they just don't get the same enjoyment out of it that they used to.
Yeah.
Something else that people might experience is fatigue. Even if they're getting a full night's sleep, they still wake up tired and just not having the energy to do the things that they normally do during the day.
Yeah.
Something that people also might experience is a general feeling of hopelessness, or a feeling that nothing they do, no matter what they do, nothing's going to get better. And along with that, people might feel feelings of worthlessness or guilt. And sometimes those feelings can be a barrier to receiving treatment. Either they think it doesn't matter if they seek out treatment because nothing's going to get better, nothing they can do can make their condition or the world better, or they feel like they don't deserve to get treatment or deserve to feel better.
Yeah.
Something else that might happen that some people experience as a symptom of depression is changes in their sleep patterns. So maybe sleeping much more than they used to, or not sleeping as much as they were. Same with appetite, might feel more hungry than normal or less hungry than normal.
Yeah, these are all important signals really to take a look at and to potentially not make a self-diagnosis, but to seek some professional help, which we're obviously going to talk a little bit about today. Christine, you also talked about anxiety and the disorders that are associated with that. What is anxiety?
Good question. So anxiety is an intense, excessive and persistent worry and fear about everyday situations. And anxiety is kind of a umbrella term, as there's several different types of anxiety disorders. The most common that people might have heard of is generalized anxiety disorder, social anxiety, or panic disorder.
Yeah, and on the same lines as depression, is anxiety and the disorders the umbrella of that? Does it affect a lot of people as well?
Absolutely. It's estimated that about 40 million adults are affected by some kind of anxiety disorder each year.
40 million. That's a lot of U.S. citizens, for sure.
Yes, absolutely. And with anxiety, we see that some of the symptoms typically develop or start before the age of 21, but anxiety can follow someone throughout their life. So they might have started developing symptoms as a young person, but it can continue or can creep up again, those symptoms, as they get older.
Yeah, and I guess self-awareness is pretty integral to trying to navigate that as well. Symptoms like the depression, you did a fantastic job just kind of outlining what people could experience or what they can notice. What are the symptoms of anxiety?
Yeah, so like depression, anxiety can look different from person to person, or considering what kind of anxiety disorder one might have. But in general, we might see someone having a fear of leaving their home or leaving their living environment. They might have a sense of doom, or that something bad might happen if they leave the comforts of where they are. Sometimes people might experience a severe change in their mood. So maybe someone who's usually happy, very outgoing, patient, they might suddenly be irritable or become easily frustrated with things that normally they wouldn't get frustrated with. We might also see that someone experiences restlessness. So maybe they pace a lot, or when they're sitting, they can't sit still. They're shaking their legs, wringing their hands, playing with jewelry. And then along with that, we might also see people experience muscle fatigue or muscle tension, which goes along with older adults, because they might bring up at a doctor's appointment, they might bring up that they've had excessive muscle pain. And a doctor or a medical professional might misconstrue that as something physical instead of something related to their mental health condition or a mental health illness. Something else, another symptom that can be misconstrued in older adults is difficulty concentrating or difficulty retaining information. So sometimes in older adults that might be misconstrued as the development of a memory disorder like Alzheimer's disease or some type of dementia, when in fact it can just be a symptom of anxiety or an anxiety disorder. And then like depression, anxiety can also cause changes in our sleep patterns, as well, again, as after getting a full night's sleep, not feeling well rested in the morning when you get up.
Yeah, and going back into what you were talking about with the comorbidities, one can easily have depression, and they can also suffer from anxiety disorders.
Yes, absolutely.
So we're just serving seniors, but we're also serving caregivers too, and a lot of people come to the table. How does mental health affect one's ability to provide care to the person that may be dealing with a mental health issue?
That's a great point, and I'm glad you brought it up. Because while anyone who's living with a mental health condition, it can be overwhelming and difficult, especially if they're facing barriers to accessing help or treatment. It can be extremely overwhelming for a family member or a loved one who's caring for someone that's living with a mental health condition, especially if they're caring for someone who's living with a mental health condition and a chronic illness like cancer or a memory disorder or something else that really limits a person's ability to care for themselves or do things for themselves. Caregivers might find that they're having to do more for the person for implementing safety measures or repeating things for the person. So it's important that we're looking at not only the client or the person who needs help, but also the caregiver and giving them support as well.
Excellent point. Thank you very much, Christine. Please stay with us while we take a short break. As usual, don't forget to have a pen or pencil ready. During the break and at the end of our show, we'll be running contact information for the Aging and Disability Resource Center Helpline, the Area Agency on Aging Mental Health Counseling Program, and the National Alliance on Mental Illness.
Many of us don't want to believe that elder abuse, neglect, or exploitation can happen to a family member, a friend, or even ourselves. Elder abuse is a growing problem and is severely underreported. Many victims are reluctant to report due to fear, embarrassment, shame, or guilt. In order to prevent elder abuse, we must take action. Don't be afraid to talk about the issue and report it to the Florida Abuse Hotline at 1-800-962-2873. Together, we can make a difference.
Welcome back to Aging on the Suncoast. During the first half of the show, Didion helped us understand a lot about mental health and how it affects older adults. So let's evolve this conversation and learn about some resources available to you. So Kristina, I wanted to go back. You really explained a lot about mental health and the issues, and the two major mental health issues out there were depression and anxiety disorders. And we talked a lot about symptoms and the statistics and all that, and you really provided a lot of great detail. What we didn't really talk about, which we kind of think is a good segue for the second half of the show, is if somebody is starting to experience or they notice that they think that they're experiencing these symptoms, what do they do?
Absolutely. So older adults can seek professional help to have those symptoms evaluated, possibly receive a diagnosis, and receive treatment for any kind of mental health condition or symptoms that they're experiencing. And that's why we're here today, to talk about one of those resources.
And that's in lieu of self-treating and also ignoring, right?
Yes, absolutely.
Yes. That's what we're trying to promote is that if you notice these symptoms, it's extremely important to seek professional help. And that's why we invited Kristina Jalazo on the show today, who has got a wealth of experience operating mental health programs in Pinellas and Pasco County for some time. Kristina, we talked about NAMI, which is the NAMI is the acronym for the National Alliance for Mental Illness, and is that a good resource for individuals in our community?
Jason, thank you. It's a great resource. NAMI is a National Alliance on Mental Illness, and they develop mental health information for distribution nationally. But just like our senior helpline, they can also provide you resources for counseling services that are available locally. NAMI also has several affiliates in the state of Florida, and the closest one is in Pinellas Park.
Yeah, and we've worked with them for a number of years over there. They put out some real good educational materials out there. As employees of the Area Agency on Aging, do you provide help with mental health issues?
Yes, we do. Counseling program has been funded by the Area Agency on Aging since 1974. And just like our senior helpline, we provide resources that are available locally for counseling needs.
We sure do. Tell us a little bit more about who the Area Agency on Aging is. Let's set the groundwork, the foundation for them.
So Area Agency on Aging is a private, not-for-profit organization that's been serving the needs of elderly since 1974. We are funding and oversight agency, contracting with our NAGIN network in Pinellas and Pasco counties to provide home and community-based services to the elders.
Home and community-based services. What exactly are home and community-based services?
We provide a variety of home community-based services such as case management, caregiver support services, evidence-based practices, nutrition services, mental health counseling services, and that's why we're here today, Jason.
Yeah, we are. We sure are. And I love talking about this subject all the time about what the Area Agency on Aging does. And all of these services certainly help people to remain at home for as long as possible in there. And for our viewers, there's good contact information on the in the middle of the show and at the end of the show, and hopefully you'll have your pen and paper or whatever technologically advanced things you have to connect with us at that time. So as it relates to counseling support, what does the Area Agency on Aging have to offer?
So Area Agency on Aging employs licensed mental health counselors who provide emotional guidance and support and treatment of psychiatric disorders if needed.
Yeah. Where are these counseling services located at?
The counseling program serves both Pinellas and Pasco counties. We can provide services in the client's home or out in the community. We are currently working out of Hale Center in Dunedin. On Wednesdays, our counselors there to provide face-to-face therapy sessions to the clients. The pandemic allowed us to offer an innovative ways to provide counseling without a direct face-to-face contact. So we started utilizing a telehealth modality. So telehealth is a virtual platform that allows a counselor and a client to have a safe and supporting counseling session in the comfort of their own homes. It's very easy. The counselor will send a link to the client when it's time for the session. The client logs in, and voila, you are connected to your counselor. The telehealth is a great platform to be able to meet clients' needs in this time of uncertainty.
It's one of the positives that actually came out of this pandemic, isn't it, Kristina?
And I just would like to add that we base each modality based on clients' needs.
Yeah.
So when we do a triage that will go into the next segment later, we will determine what kind of services are better for clients.
Yeah, that's a good point. So you're allowing clients really to express to you what their needs
Exactly.
are. It wasn't that long ago that I was working with these counseling programs under the Older Americans Act, and we're going to talk a little bit about the funding later. It was when I would review files and talk to the professionals working with the mental health program, I was kind of struck by the fact that they were receiving counseling in places in the community, such as a McDonald's or maybe even a Starbucks or in a park. And there was good reason for that. And because the person that they may have been caring for, as we were talking about earlier, Christine, they needed to have a separation from that person, especially if they were homebound in there. So meeting them where they present themselves is super important on that. Let's talk about the funding. You know, funding is funding. It's fantastic, but it always has little things tied to it. So let's talk about who's eligible and what do these services cost people.
Okay. So the counseling services are available to any senior age 60 and older in Pinellas and Pasco counties. The special emphasis targets low-income groups, clients living in rural areas, minorities, social isolated clients, and of course counseling services are free. Yeah. The clients are given a chance to contribute if they wish to do so, but counseling services do not depend on their contribution.
Yeah, and the Older Americans Act has always been pretty good at that, taking a look at at-risk populations and trying to attract them and serve them first. We talked a bit in the monologue that African Americans and Hispanic Americans were least likely to accept counseling services, and this is something that we want to do a little bit better at and show the benefits of that. So if I were to call the numbers that we saw on the graphics out here and try to reach out because I recognize the symptoms that Christine eloquently provided at the first half of the show, what should I expect?
It's a great question, Jason. So first of all, they will go through a triage process. Our intake specialist will complete a short assessment. The individual should be ready to give out their demographic information, and demographic information will help us reach out the targeting population that I've talked about earlier, the low income, the clients living in a rural area. We also take a short mental health assessment to help us determine exactly what kind of counseling modality does the client need to help us link with the correct counselor. And as you said, funding is funding, and of course, there's a lot of times there's a wait list. So some clients get released immediately based on the need and based on their priority, but majority of clients do get placed on the wait list.
Yeah.
The wait list does get reviewed every month, and more often as necessary. And once we have a room on counselor's schedule and funding to pay for it, we do release clients.
Yeah, and just because we're being transparent and acknowledging that there is a wait list, that shouldn't be a barrier for people to call because they think they would be on it, right?
It should not, and you should definitely call us. So what I would like to do is encourage individuals to call through the senior helpline. While you can definitely call our main number for counsel and talk to my intake specialist, senior helpline staff is highly trained to identify any other resources and any other needs that client that can be met through our funding.
Yeah, and that's we like to pump the helpline all the time for that. That's why we put the numbers in the graphics so people can understand that, because our helpline they're special people.
Yeah,
they talk on the phone all day long to people in need, and then where somebody calls the helpline because they think they have a certain need, sometimes they don't understand that some other needs that they may have that we can be able to help them with, and the helpline just does a phenomenal job. Kristina, I asked this to all our guests. Actually, we're all social service people at heart, and we very much tout our the services we provide. The question that I ask is, everybody, can we do this alone, or do we need help too?
No, Jason, we cannot do this alone. We definitely utilize a full complement of community-based resources that are available, and we base it on each individual's client's needs. Yeah. So, for example, if I may, we had a client that called in directly to our counseling program, identifying the need for counseling. The intake personnel, they triaged, and they've determined that this client could greatly benefit from home-delivered meals and assistance going through legal system. So we were able to refer a client to our nutrition provider. Client is now receiving home-delivered meals and is getting help through the Victim of Crime Advocate program to go through the legal system.
Well, you really met that person holistically on here.
And that is why I want to emphasize again, please contact Senior Helpline, because they will be able to provide more resources and more services that could be available to every individual.
Yeah, and I can see somebody that didn't have a meal in their home, or maybe help with some cleaning, or some help with some navigation of court systems doing to a victim, that they just feel a lot better that they're going on in addition to the counseling services. Kristina, Didion, thank you so much for coming on Aging in the Suncoast. It's always nice to see you.
Thank you for having me.
Yep, and Kristina Jalazo, thank you for coming back on on Aging on the Suncoast. It's always great to see you as well.
Thank you for having us, Jason.
Yeah. We hope you enjoyed this month's broadcast. We also hope this episode encouraged you to seek assistance through the Area Agency on Aging's mental health counseling program. We're here when you need us to ease the challenges you may face. We'll see you next month, and until then, seize every opportunity this year has to offer.
Many of us don't want to believe that elder abuse, neglect, or exploitation can happen to a family member, a friend, or even ourselves. Elder abuse is a growing problem and is severely underreported. Many victims are reluctant to report due to fear, embarrassment, shame, or guilt. In order to prevent elder abuse, we must take action. Don't be afraid to talk about the issue and report it to the Florida Abuse Hotline at 1-800-962-2873. Together, we can make a difference.